There is strong evidence to support the many benefits of skin-to-skin contact for both the gestational parent and newborn. Some of these benefits include enhanced bonding and attachment, improved rates of breast and chest feeding, decreased surgical complications, and regulation of the newborn's heart rate, temperature, and blood glucose. The following video is a step-by-step guide to safely facilitate skin-to-skin contact in the operating room during a cesarean birth. When prepping the abdomen for surgery, the antiseptic solution is applied higher and closer to the patient's chest. This preparation will help facilitate passing the newborn directly below the surgical drape for immediate skin-to-skin contact with the gestational parent. Once the antiseptic solution has dried, place a sterile towel on the abdomen, above the umbilicus, and over the gestational parent's chest. This step will serve to prevent the sterile drape from sticking to the gestational parent's skin, allowing the newborn to be passed beneath the towel. In your table setup, include a cord clamp. A nurse dons sterile gloves and is positioned at the head of the OR table, close to the gestational parent. The nurse is ready to receive the newborn when passed underneath of the drape by the surgeon. This technique minimizes the risk of contamination to the sterile field. At the time of birth, a second healthcare provider wearing clean gloves places their hands underneath the blankets and lifts them up. This step creates a passageway by lifting the sterile towel and drape upward, opening a space for the newborn to be passed through. Once the newborn is placed in skin-to-skin contact with the gestational parent, care providers can perform an initial assessment of the newborn as per NRP protocol. At the time of birth, if the newborn requires additional assistance and immediate skin-to-skin contact is not possible, assessment at the radiant warmer is completed and the newborn is returned to skin-to-skin contact as soon as possible. While in skin-to-skin contact, the newborn is placed prone, horizontally across the gestational parent's chest, keeping contact with the parent's skin. Cover the newborn and parent with warm, dry blankets. Ensure the newborn's face is visible and that there is no obstruction to the airway. During this time, care providers will perform frequent visual assessments of the newborn's breathing and color, as well as vital signs. Demonstrate to the support person where to place their hands on the newborn's buttocks or thigh to ensure safety while in skin-to-skin contact. The gestational parent may have limited ability to provide support to their newborn at this time. If the gestational parent is not able to provide skin-to-skin contact, place the newborn in skin-to-skin contact with the support person if they are available and agreeable. Cover the support person and newborn with a warm, dry blanket. It's recommended to resume skin-to-skin contact with the newborn and gestational parent as soon as possible. The gestational parent and newborn can be safely transferred to the stretcher from the OR bed without interrupting skin-to-skin contact. Following removal of the sterile drapes, in preparation for transfer, the newborn is positioned vertically on the gestational parent's chest. The gestational parent is instructed to cross their arms around the newborn to hold them securely. A healthcare provider is positioned close to the gestational parent so they can place their hands directly on the newborn to provide additional support during the transfer. You must have an adequate number of care providers present during the transfer procedure to ensure safety for both the newborn and the gestational parent. The gestational parent and newborn are transferred to the post-anesthetic care unit while maintaining skin-to-skin contact. Supporting skin-to-skin contact practices following a cesarean birth can optimize outcomes for both the parent and the baby and provide a very meaningful experience for the families we care for. We hope this video was helpful to you as you promote skin-to-skin contact practices in the operating room at your birthing facility.